Hello, future osteopaths. My name is Alicia Rodgers, and I'm a fourth-year medical student at Ohio University Heritage College of Osteopathic Medicine. Today, I'm going to be showing you a clip of me demonstrating two osteopathic manipulative treatments, specifically that of Effleurage and Galbreath. So I was in a pediatric office when I had a young patient that came in, and their grandmother was looking for techniques that would help with their sinusitis, so inflammation of the sinuses, common respiratory complaint, especially seasonally. And the grandmother wanted to have some strategies and techniques that could help her feel better without the use of medicines. And so it was a great opportunity for me to use and share my background and training as an osteopathic physician in the making about some techniques that would satisfy the request that she had. So I'll show two techniques that I demonstrated for them to do at home. So the first one is called Effleurage. So what I'm gonna do, and I'm demonstrating on my cousin here, is you just start with the ethmoid sinuses, so they sit right under this area high up on the nose, that bridge there, and you just work by just kind of like massaging the area. It's not so much so a massage, but it's the just the very gentle. Does that feel weird? Yes. So that very gentle technique. And then I move to the frontal sinuses. So now I'm moving the fluid that collects also in these air pockets up here. So the ethmoids right in this area are very, very small, and they're just like little air cells, but through the frontal region, it's a lot bigger airspace. And if you ever hear people whenever they have sinus issues, they just feel a lot of pressure, and this is that area where a lot of fluid can collect. So after I do that, then I move down. So the maxilla is this bone that sits right at the high part of the jaw and even makes part of the cheekbones. And so then I just move here, and I'm also moving fluid here as well. So these are all of the air spaces that sit in the skull, and bacteria likes to collect in these areas, and that's where that fluid collects because of all the immune cells that go to the site of infection, and it causes a lot of just like leakiness of like different blood vessels and things that circulate in those areas, and that's what causes that inflammation. So those are the three main things that I do for Effleurage. And then the final technique I showed, so I have the patient turn their head to the side, and I have her little sister here as an assist as well. So you have the ear canal that goes down like this and into the throat. So the idea is that you then come around like this. So this technique is called the Galbreath technique. And I'm just kind of holding along her jawbone here, called the mandible. Come this way, sis, for me. And then all I'm gonna do is just stroke down like this. You wanna help me? You wanna help me? And I just come like this. And so the idea is that sometimes with draining of the sinuses, and then any other just upper respiratory techniques as well, this just helps to further move that fluid down along this way. And so these were techniques that I was able to show the grandmother to do for her grandson in the clinic. And I finished that rotation, but that patient came back later, and it was awesome to hear from another student and colleague of mine who said that the grandmother, when she came back, she remembered the encounter that we had, and how helpful it was to walk out of the clinic with something that would help. And the patient did recover pretty quickly, and they got quicker relief.